Welcome back to the We Care podcast. I'm Jordan Vaughn, nurse practitioner.
And I'm Molly Cooey, nurse at We Care.
So today we are breaking down one of the most common questions I get in clinic, or we get in clinic: pellets, orals, creams, injections. What's actually best for hormones? And the answer is, it depends.
There's a lot of noise and very strong opinions online around hormone delivery methods.
Well, and they're not like a one size fits all, and neither is delivery. So today I want to walk everyone through each option and how we think about it critically.
So let's start with the creams and oral hormones, since that seems like it's where many patients begin.
Yes. So creams, they can be really helpful early on. They're really easy to adjust. They're non-invasive. It's just absorption can be a little bit unpredictable with the creams. Things like skin type, their application consistency, transfer to kids and partners and pets, that also matters when it comes to the creams. Oral hormones, they are often like the easiest prescribed, and that's typically what patients come from their primary care providers to me on. A lot of traditional medicine uses oral, but they're not always the best option for our patients. For instance, like when estradiol is taken orally, it has to pass through the liver. So during this process, it can be metabolized in multiple different pathways from the liver. And some of those, they produce less than favorable, like even harmful results sometimes. Those little metabolites that they, turn into, they can bind to different estrogen receptors, and they can contribute to some unwanted side effects and long-term health risk. Also, oral options, a lot of them are synthetic, and they are definitely associated with risk. And some of the synthetics are what we know as birth control. So I'm sure you've heard of blood clots and all the things that come along with that. The only hormones that we should take is bioidentical, and they will fit like a glove to our natural receptor sites. Now, I do personally give oral micronized progesterone to my patients who are getting the estrogen pellets. Oral micronized progesterone, that is a bioidentical hormone, and they even help with sleep, and that's why most of my patients love them.
Right, we need that.
Yes.
It's also common for missed doses for these types of medication options.
Absolutely.
Especially with so many of our patients' busy schedules.
Yes.
So next, let's talk about the injectables.
So injections, they can be effective, very effective, and they're also a little bit more affordable for some patients. They can cause peaks and valleys, so that is kind of one of the negative side effects to injections. That up and down, it can, lead to crashing for some of the patients, especially, on that weekly dosing that most people are prescribed, and some less than that. We also can see a little bit more mood swings with injectables, which is something that I don't prefer for women especially. I wanted to kind of give a few examples like on that for the injectables. So I had a female patient come in for her pellets the other day, and she was telling me about her husband. He was on a monthly dose from his primary care provider, and he was crashing out after like 7 days and struggling to make it to his next dose a month later. So she sent him in for labs. He was 3 weeks, from his injection, not due for another week, and his labs were in the low 200s, and that is on therapy. Optimal range for testosterone is anywhere from 700 to 1200, and we have this guy on therapy at 200.
Wow.
So obviously he is a patient of mine now. And then I have a few men who are on therapy with me, and we've done the weekly injections, and they can't even make it to day 7. So it's definitely personalized. And some of those guys have to do bi-weekly injections and split in that dose. And I even have a couple, they like the microdosing option. So that's a daily testosterone injection. Seems like a lot of work to me, but it does work for some. Right. And then women. I want to talk about women with injectables. I don't feel like the injectable testosterone is the best option for women. It has more of that DHT conversion, and we see like negative side effects. Sometimes if testosterone is too high in women, we see a little bit of hair loss, facial hair growth, just some negative side effects that we don't see with other methods.
Right. So all that kind of brings us to what I think of as your favorite method, which is the pellets.
Amen. It really is. I feel like that pellets, they just offer the most consistent delivery. The pellets are released very steady over time. There's no weekly spikes. It very much mimics how the ovaries and the testicles produce our hormones. I mean, you want it to be consistent. We want it to match our natural output.
Right. That consistency really matters with the hormones.
Absolutely. And it matters for like your mood, your sleep, your libido, just overall stability.
So why did you choose to go with the Avexipel brand for your pellets specifically?
I prefer Avexipel pellets because pharmaceutical grade quality, they have predictable absorption patterns, and they also work with an FDA approved pharmacy called Pharmakeo. The pellets that they formulate, they're actually surrounded with a small dose of triamcinolone and they're and methyl cellulose. And that keeps it like a slow, steady release of the hormone, and it keeps down the inflammation at the insertion site compared to other brands of pellets. They also have like strict dosing standards. So like they have a dosing site that the providers can use to help, dose those first pellets, those follow-up patients, just making sure based on their labs and all the different factors, their symptoms and their checklist, you can put it all in a dosing site, and it really helps guide the providers and also track their symptoms and adjust it, slowly over time. They also offer extensive provider training, which is probably one of my favorite things about the company. They will train you. They will retrain you. They will retrain you again. They give you all the advanced knowledge that you need to do this therapy. And then they give you a practice support specialist. And Matt, the one that we have for We Care, he's phenomenal. He has supported us in every aspect. I can call him. I can text him. I can send him a picture. He's on it within minutes, and I just love working with him.
It's awesome to have support like that.
Yes.
So it is also important to say that pellets are not for everyone.
No, I would definitely say someone who is an anxious person, a picker, something like that, you might not want to place something under the skin for them. They're really best for patients who want consistency. If you're done having kids or you're not going to have kids for a long period of time, pellets would be a good option. Or if you struggle with compliance on some of the other options like orals, taking it consistently, or someone who just wants fewer hormone swings because it's more natural.
Right. So, and the pellets are not just a set it and forget it treatment. We still have to monitor labs and symptoms.
Absolutely. So with pellets, you want to bring them back in like 5 weeks. You want to, check what that lab looks like, and then we can adjust the dose for them. So if they say, I'm still having symptoms, I'm still, just not feeling well, then I can give a, free booster dose. And that is something that Avexipel offers as well. They allow me to change the dose for my patient if needed with a free booster dose. And I love that.
That's awesome. So let's get into some myth busting.
Yes.
All right. So myth number 1, there's one form of hormone therapy that is the best for everyone.
There's no one size fits all with hormone therapy. Pellets, orals, creams, injectables, each of them have their own benefits and they have some limitations. The best option, it's going to depend on the labs, the consistency of the patient, the compliance, past response to different therapies. Good hormone care is just personalized medicine.
Yes. So myth number 2, you can't adjust pellets once they're placed.
Okay, so pellets can't be removed. You can't take them out, and they can't necessarily be turned off, but you can, adjust it for the patients based on their labs and symptoms. And that's where that dosing calculator and all of that comes into play with Avexipel as well. They do dissolve naturally over time. They are not permanent, but I cannot pull them out.
Right. So myth number 3, pellets give you too much hormone at once.
Pellets do not give you too much hormone at once, especially with the Avexipel brand and that methyl cellulose. Patients are delivered a slow, steady release of hormone for 3 to 4 months for women, 5 to 6 months for the males, and it helps avoid the daily fluctuations, peaks and valleys of creams and injections.
Myth number 4, creams don't transfer to others.
Creams absolutely can transfer to others. Hormone transfer it's a real risk. I mean, you have to worry about your children and your pets, and that's why proper education is absolutely critical when you have a patient starting hormone therapy creams.
Yes. Myth number 5, testosterone injections are only for bodybuilders.
Now that's a big one. Testosterone injections, they are used to treat clinically low testosterone levels in both men and women, not just bodybuilders, and we do it in appropriate doses based on their labs around here.
Correct. All right. So Jordan, tell me how you pick the correct method for somebody at WeCare.
So at WeCare, we don't push the one option on everyone. We definitely consider, their symptom checklist that every one of them fill out, their labs, their lifestyle, their goals, their tolerance of fluctuations, and we make a plan together. So it's not, hey, this is the only option I have for you. It's not about a trend. It's just about stability for that patient. And if you come in and you don't have the funds to pay for pellets, I'm not going to push pellets on you, but we are going to talk about what would work best.
Yes. So if you're curious which option is right for you, be sure to reach out to us at WeCare Health and Wellness, and we will help you find the right fit.
And that's going to wrap it up today for this episode. Be sure to tune in to our next one.
Make sure to subscribe, follow WeCare Health and Wellness for more education and behind the scenes. And don't forget that at the end of the day,
WeCare. We'll see you next time.